Good afternoon, and thank you for joining us for this afternoon's virtual media briefing about COVID-19 in London and Middlesex County. We're happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Middlesex-London Health Unit's Medical Officer of Health, Dr. Chris Mackie. A welcome to you this afternoon who are joining us as well, to the members of the media. Thank you, and remember to submit your questions. Just use the question form here on Microsoft Teams. If you hover over the middle of the screen and the taskbar appears, just click on the text bubble with the question mark on it to submit your questions. And when you do, if you could please indicate your name, your media outlet, and who your question is directed to. A welcome this afternoon also to viewers who are tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners to Global News Radio, AM 980 CFPL, and those who are tuning in this afternoon on the CTV London website. Let's get to our opening remarks right away, and we will start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. So here's the number, 5,296. It's the number of COVID diagnoses that have occurred since we realized there was a pandemic. 161, the number of deaths that have occurred since that time, which includes one today. And while those are significant numbers and we take no solace in them, and we provide empathy and offer our condolences to the families for those who have died, I'd like to highlight a couple of reasons why I have some sense of optimism this week. First and foremost, we continue to see the evidence that more Londoners are taking the public health guidelines very seriously. And we know that because numbers don't lie. Over the last 5 days, we've averaged some 62 cases per day in London Middlesex. That's down from an average of 94 over the prior 5-day period. We all want those numbers to head lower still, and if we stick to what we're doing, I'm hopeful, reasonably hopeful, that we will get there. And it's important to remember that while the spike in daily case counts happened rather quickly, the road back to more what I would call manageable numbers can be slow and tedious. Still, progress is being made, and that progress is undeniable. Thanks to everyone who's doing their part, because you're making sacrifices and you're saving lives. Speaking of saving lives, my second cause for optimism. Despite a nationwide shortage of vaccines, public health officials remain on target to vaccinate all long-term care residents in our region over the shortest next while. It pains me to say, despite being in regular contact with the Premier, that municipalities have very little control over vaccine supply. Clearly, it's a national issue, and one that involves international suppliers. What we can control is how quickly and how effectively we administer that vaccine once we have it. And in that regard, our public health officials have absolutely done a phenomenal job. Having every long-term care resident vaccinated is a remarkable achievement, and it's one we know will save lives. My deepest thanks to everyone involved in that effort, to the staff, the residents, the PSWs, the health unit, and the LHSC. You know, they've demonstrated that once we have the vaccines, we have a delivery infrastructure that's firing on all cylinders and capable of making the most of what we have. We're making a strong case that when the national distribution chain ramps up, London should be at the front of the line to receive more doses, especially if the priority is to administer those shots as quickly as possible, particularly to those most in need and at risk. We've proven we're second to none in that department. And again, I'd like to express my gratitude to everyone who's involved in that effort. You really matter. Thank you. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. So we have another good day from perspective of case counts, both locally and across the province. Here, just 63 new cases, 1 death, and across the province, just over 2,600. These are quite down off the peaks from about 2 weeks ago, and they both are part of a strong downward trend over that time period. From the vaccine campaign perspective, as you know, the Agriplex clinic is being put on hold after Friday because of the shortage of vaccine supply. Tremendously impressed and grateful for the work of LHSC, the health unit staff, and everyone involved in that clinic. We're doing very well also in terms of the campaign from the local perspective around vaccinating all long-term care facilities. We will have those facilities all vaccinated by this weekend. The facilities will be vaccinating between now and Monday include the following: Henley Place, Craigswell Gardens, Chartwell Park Hill, Kensington Village, the Village of Glendale Crossing, Westmount Gardens, Babcock Community Care, and People Care Oak Crossing. You can see that our teams have been and will be busy. We'll get that job done. And the other positive part of this story is that we're now in our 11th day after vaccinating at the Oneida Long-Term Care Facility. And that means that the people vaccinated there are now becoming immune. It's around day 8 that the immunity starts to develop, and by around day 12 to 14, you've got almost 90% and potentially over 90% protection against the COVID virus. So that campaign is starting to pay off, and it will continue to pay off as more and more of the people that have been vaccinated in those long-term care homes become immune over the next week or two. Dan, I'm going to pause there. Looking forward to any questions.
Thank you very much, Dr. Mackie. Thank you, Mayor Holder, for your opening statements this afternoon. And yes, we do have a few questions. Just a short queue right now, but I expect as people hear answers and people get their thoughts together, we'll see the number of questions increase in short order. So let's begin. Jennifer Beeman at the London Free Press is tuning in. Dr. Mackie, she's got a question for you. Dr. Mackie, are you disappointed with how the second wave has hit long-term care homes? What more could have been done to avoid the deaths and cases that have been linked to these facilities in recent weeks?
You know, obviously, whenever there is a death, that is a disappointment. The positive is that we were able to hold the virus off from long-term care for many months in the second wave. You know, from basically the beginning of the second wave in September right through to mid-December, we had minimal cases and much fewer deaths. And every, you know, holding off for that time period means that lives were saved and lives were extended, and that made a big difference. So overall, happy that we've been able to hold things off for so long there. It's obviously, you know, disappointing to see the deaths accumulating there. And the biggest factor that we all wish could be changed is vaccine coming sooner.
All right, thank you, Dr. Mackie. And a follow-up question from Jennifer Beeman. Dr. Mackie, there have been 20 deaths at Country Terrace and 12 deaths at Middlesex Terrace connected to the current outbreak. How does the fallout of the second wave in care homes compare with what the London area experienced back in the spring?
Yeah, it's pretty similar at this point, Jennifer. We've had more deaths in the second wave than in the first wave. We crossed over that threshold about a week and a half or 2 weeks ago. In terms of long-term care deaths, unfortunately, they continue, as you point out, to accumulate. So we will be going, you know, likely beyond that first wave. And the pattern is pretty similar in terms of the number of people that have passed in the second wave being around 60% or more in those long-term care facilities. So it's quite comparable. You know, the case counts are higher because we're testing a lot more in the second wave, but at this point, the mortality is fairly similar. That said, we're, you know, just at best in the first half of this second wave. So it will eclipse the first wave by the time we're through.
Thank you, Dr. Mackie. Let's go to our next question. Sophia Rodriguez is tuning in from CBC London this afternoon. Dr. Mackie, with the reduction of vaccine supply across the country, when can healthcare workers expect to be able to get their shots?
Now, we don't have clarity in terms of when this campaign will be able to move into healthcare workers more broadly. We expect there will be additional doses the beginning of February. They obviously will go first to vaccinating the second doses for those that have received their first dose to make sure that that first dose really holds and that immunity that does come on after about 2 weeks after the first dose is extended and doesn't fall off. So that'll be the first priority, and that will mean, you know, the roughly 10,000 people that have been vaccinated from the Agriplex and several thousand residents in long-term care will need those vaccines first. Once those are done, then we will move to other groups. There's still, you know, several weeks of work to be done to figure out which groups are next, and we do expect that that will be directed by the provincial government, so more to come on that.
Thank you very much. And if you are a member of the media tuning in this afternoon and you are thinking about submitting your questions, now would be a good time to do so. We've only got a few left in the queue, so that is your warning, I suppose, to get your questions in. Let's go to the next one. Jennifer Beeman has another one from the London Free Press. Dr. Mackie, has rapid testing been used in London area long-term care homes and that are in the second wave?
Yeah, we have seen use of the rapid tests in long-term care homes. It's helpful from a timing perspective. It has to be done more frequently, though, because it is not as sensitive as the nasal swab that's analyzed in a lab. The rapid tests are, you know, better than half, but much lower sensitivity. So if it's, you know, it's got to be done more frequently in order to approach the same value as the NP swab that is analyzed in a lab.
All right, let's go to the next question. It's a follow-up from Sophia Rodriguez at CBC London. Dr. Mackie, with declining case numbers, does this mean we have peaked? Can we expect more surges in the months to come?
Excellent question, Sophia. So, you know, we have peaked. It doesn't mean it's the last peak that we'll see. So hopefully this decline is something we can continue in the weeks and months to come. There could be any number of reasons why we might see case counts go back up again. You know, if we see behavior being relaxed too quickly, we could see a jump in cases. If we see, you know, if we do see UK variant spreading more rapidly here, we could see jump in cases. But we're all very much hoping that people can keep up the good behavior that has brought cases down, and we can keep seeing things improve across the community.
Thank you, Dr. Mackie. Let's go to our next question. Matthew Trevithick from Global News Radio AM 980 CFPL is tuning in. And Dr. Mackie, Matthew has a question for you. Dr. Mackie, you said previously that high-risk retirement home residents would be the focus of the local campaign following long-term care home residents. How does the Pfizer delay and remaining local supply impact that?
Great question, Matthew. We are planning to start high-risk long-term care on Monday, but those plans are tentative depending on vaccine supply. If we really are hearing new information daily about vaccine supply, and so if we have some indication between now and Monday that there will be further delays in the provincial supply, we may not be able to go out into those homes. Otherwise, we do plan to at this point.
Thank you very much. Sophia Rodriguez is back with another question from CBC London. Dr. Mackie, does the vaccine that long-term care residents are getting inoculate them against the new variants of the novel coronavirus? What do you make of the situation in Barrie, where an as-yet unidentified strain is ravaging a home there? Are you worried about it making its way here?
Yeah, appreciate the question. So, and the situation in Barrie, some of our local homes have experienced something similar, and so they've sought testing around whether any of the new variants are involved. We've asked the lab for that testing as well for the homes that have been very hard hit here. Does the vaccine inoculate against the new variants? The information that we have at this point is that the vaccination is effective against the UK variant. There may be some suggestion that it's not effective against the South African variant, but we haven't seen confirmed evidence of that variant in this area, or as far as I know, anywhere in Canada at this point.
Thank you very much, Dr. Mackie and Mayor Holder. Well, that does bring us to the end of today's questions. and to the end of today's virtual media briefing. So thank you very much for your time, for joining us. Thank you, Dr. Mackie, Mayor Holder, for your insights and your information as well. We will be back with our next virtual media briefing on Monday afternoon at 2 o'clock. So between now and then, have a great rest of your Thursday. Have a great weekend, and we'll see you next Monday. So long for now.